Hello and welcome to the first of the Equilibrium video blogs. My name is Danny Smith, I'm a consultant psychiatrist and my special interest is the diagnosis of bipolar disorder. We know that many people with bipolar disorder experience long delays between first becoming symptomatic with mood problems and behavioural problems and finally getting a diagnosis several years down the line, and there's a lot of interest around in trying to reduce that gap in diagnostic delay. This is obviously very important for improving prognosis in the long term so that people get the right treatment early, sooner rather than later. What I'm going to focus on is if you're an individual who think they may have bipolar disorder, or you're a family member of someone who you suspect might have bipolar disorder, I'm going to give you some helpful hints about how you might get the diagnosis sooner rather than later. The first port of call for many people within this predicament is to go and see their family practitioner. And it's really helpful if someone who knows the person very well can go along to that initial appointment and just very clearly outline the problems with mood and behaviour that seem to have been occurring and which seem different from normal functioning for that individual. This might be particularly important if there's a strong family history of mood problems. For example, if someone in the family has bipolar disorder, which happens reasonably commonly. So if there's a suspicion that that's the case, the first port of call is the family practitioner. Following that, it would be usual, based on their assessment, to have a follow-up assessment, usually with a psychiatrist, occasionally with a clinical psychologist. And again, support of that individual at that initial assessment is very, very important. We know this because many people who suffer from periods of hypomania or overactivity often don't realise that they're having these symptoms over a number of years, and it's often very helpful for someone who knows that individual very well to give a clear account of how their behaviour has changed over the years. We know that bipolar disorder tends to start in adolescence and early adulthood, and usually for the majority of people that's with an episode of depression. So a clear account of how symptoms might have evolved from an initial depressive episode over months and years leading up to the concern about bipolar disorder is very important. The psychiatrist or psychologist will take a very detailed history. That will include a family history, but it will also include perhaps some screening instruments for bipolar symptoms. These can be very helpful, but they're never diagnostic, and I would encourage you to use these screening instruments as a way to start a conversation about whether or not the person you know very well or yourself might have had symptoms such as those outlined in the screening questionnaires. The most common screening questionnaires are something called the Manic MDQ, the Manic Depression Questionnaire, or the Major Depression Questionnaire, or the HCL32, which is the Hypomania Checklist 32. So, given that someone has an early suggestive diagnosis of bipolar disorder, how can you, as a family member, help them in the early stages of that process? I think the most important thing is to support the individual in terms of helping them think about the need for medication, the pros and cons of medication, helping them to do things like monitor their mood on a regular basis, helping them to think about the importance of regular daily routines, patterns of sleeping and eating and exercising that we know are very important in maintaining stability for people who are prone to bouts of high and low mood, and also helping them think about planning for the future should they become unwell at some point in time. Is there something that you can talk about in terms of, for example, the need to go into hospital and their preferences if they develop a severe episode of mood disturbance? What would they like you to do for them in those kind of scenarios? So that's the main, I think, advice I can give for individuals and family members. But there's quite a lot that professionals can do to improve the early detection and diagnosis of bipolar disorder. And I think perhaps most important is something I've already mentioned, which is that professionals should involve family members and informants in the process of the diagnostic assessment so that they get a clear history of the main problems sooner rather than later. We know that this doesn't often happen in a lot of cases, and it's kind of like my top tip for improving the rate of correct detection of bipolar disorder, interview a family member, take a very clear history, a detailed history, look at the family history of other mood and maybe mental health problems, and consider also using some of these screening questionnaires like the MDQ and the HCL32 that can really help to take a more detailed history of the individual. The other important thing that many clinicians perhaps are not very aware of is that the clinical syndrome of bipolar depression versus unipolar depression, although similar in many regards, they do share a lot of symptoms in common. There are subtle differences between the bipolar depressive episode and the unipolar depressive episode. For example, individuals with bipolar depression slightly more often will complain of sleeping too much, of eating too much, of having extreme fatigue, of maybe having racing thoughts more commonly, of maybe lacking a bit of insight into being unwell at that point, relative to people with more straightforward unipolar depressive syndromes. And of course, the main thing to try and get a handle on is, has this individual that you're assessing got a clear history of several days of elevated overactive mood that has interfered with their function to some degree, and which is way beyond what might be considered a normal expression of their personality. Finally, I think it's very important for health practitioners to be aware that bipolar disorder, especially in the early stages, is often very difficult to get right as a diagnosis, and that's because it's such a complex condition that affects individuals in many different ways. So, for example, keep in mind differential diagnoses which are important, like personality difficulties, like drug and alcohol misuse, and maybe even in more extreme cases of severe manic syndromes, the possibility of a chronic psychotic disorder. So these are difficult diagnoses to get right, but I think a collaborative approach with the individual and with the family members, and a structured approach to using questionnaires, detailed family histories, and a longitudinal period of assessment, perhaps including mood monitoring, is the way to get it right. Thanks for listening.